when babies are born premature, again, like we said, children don't have to follow a specific timeline for development, but there is a natural timeline that, the average baby goes through. And so when you're premature, everything is now semi-disrupted, right? You're not in that womb anymore. You don't have enough time in that womb to fully develop all your organs and all your sensory systems. So, premature babies, unfortunately, are often at a higher risk of vision issues just simply because of the fact that the eyes are now slightly underdeveloped and they haven't had time to even just develop within the womb. And also, like I just mentioned, even if the eyes didn't have any trouble, their other sensory systems could be delayed. They could have other developmental delays, cognitive delays, because again, the brain might not have fully functioned. And the brain is what processes our vision. So if your brain is not adequately developed, then your vision will not develop as well because your brain won't know what to do with your eyes and how to communicate well with it. So a lot of visual processing issues could happen in premature babies. And then health-wise, right? So prematurely, your blood vessels might be very weak. They might not have fully developed in the eyes, so they could be leaky. You could get bleeding and swelling in the retina, which is called retinopathy of prematurity. And so that can cause to retinal damage and blindness. And then, like I mentioned before, if the brain and the eyes don't communicate well together, premature babies may also develop higher glasses prescriptions and more blurry vision. So they could have high myopia. They could have strabismus or that eye misalignment, that eye turn, because again, the brain's just not communicating well with the eyes. So those are, again, things to look out for. But again, as a parent, I don't feel that you should be carrying that burden of worrying about all those things. As a parent, I think just the most important task for you is just to schedule those doctor's appointments, schedule that optometry visit in advance, and just make sure you bring your baby, at that 6-month mark and that 1-year mark so that we can do that job for you and make sure nothing crazy is going on and that your baby's healthy and developing well.